Hello and welcome to our video. Strokes can strike swiftly and without warning, yet sometimes our bodies send out signals days, even a week in advance. These signals are subtle, often overlooked, but they are the keys to prevention and timely intervention. Our journey today isn't about fear. It's about empowerment, awareness, and being prepared. We're here to guide you through these signs, to help you understand and recognize them, so you can take action when it matters most. So let's embark on this enlightening journey together. We'll uncover the 10 warning signs that could herald a stroke, equipping you with the knowledge to protect yourself and your loved ones. Before delving into the warning signs, it's essential to understand what a stroke is. There are two main types of strokes. First is ischemic stroke. This is the most common type of stroke, accounting for about 87% of all cases. It occurs when blood vessels to the brain are obstructed, often by blood clots. Second type of stroke is hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain leaks or ruptures. Hemorrhagic strokes are less common but more deadly than ischemic strokes. Now there is another type of stroke called transient ischemic attack, or TIA, and it is the first warning sign of stroke that we're going to discuss. Often labeled a mini stroke, a TIA is often caused by a temporary decrease in blood supply to part of the brain, which may last as little as 5 minutes. A TIA shares many symptoms with a stroke, but unlike a stroke, the symptoms of a TIA are temporary, often lasting just a few minutes to a few hours without leaving permanent damage. Despite being temporary, a TIA is a sign of serious underlying problems in the blood vessels of your brain, and serves as a powerful predictor of a future stroke. In fact, one study found that 43% of stroke patients had a TIA within 7 days before they had a major stroke. The following that we'll be discussing are warning signs and symptoms for both TIA and major stroke, so if you experience any of these, it is crucial to seek immediate medical attention. Don't hesitate. Timely intervention can make a significant difference in preventing severe health issues or even saving your life. Second on our list, sudden headaches. One of the potential precursors to a stroke is the sudden onset of a severe headache. This kind of headache is often described as the worst headache ever experienced and can be a critical alert. It's the kind that stops you in your tracks. You might have experienced headaches before, but this one is different. It's intense, unexpected, and has no apparent reason. Unlike migraines or tension-type headaches, they peak in intensity almost immediately and feel like a thunderclap in your brain. The reason behind this sudden severe headache is often associated with hemorrhagic strokes, where a blood vessel in the brain ruptures. The leakage of blood into the brain can create a sudden and intense pressure, leading to a severe headache. Number 3, numbness or weakness. One of the most distinctive features of stroke-induced numbness or weakness is its unilateral nature. It typically affects either the left or right side of the body. This may manifest as drooping on one side of the face. Someone might notice that their smile is uneven, or one eyelid may droop. It could be a sudden weakness or numbness in one arm, which may become apparent when trying to lift both arms. Difficulty in walking, standing, or moving one leg can also be a sign. Stroke often targets the brain's pathways that manage our physical movements and sensations. When these pathways are compromised, even briefly, it can manifest as sudden weakness or numbness, typically on one side of the body, a classic stroke symptom. The brain's left side controls the right side of the body and vice versa. Hence, a stroke on one side of the brain will cause neurological symptoms on the opposite side of the body. Another vital sign we need to talk about is sudden changes in vision. Imagine you're reading your favorite book, working on your computer, or even driving, and suddenly, your vision shifts. It could be blurriness or double vision that comes out of nowhere. It could be a sudden blindness in one eye, like a curtain coming down and blocking your sight. This isn't about needing new glasses or feeling tired. It's a sudden, unexplained disturbance in your sight. When a stroke occurs, it can interrupt the flow of information from the eyes to the brain, or within the brain itself, which processes what we see. The result can be startling vision changes. Differentiating these from vision issues caused by less serious conditions like migraines or eye strain is crucial. Regular eye exams can help identify issues that may increase the risk of stroke. Number 5. Loss of balance or coordination. Experiencing sudden issues with balance or coordination can be a significant warning sign of a stroke. These balance problems may manifest in different ways and are crucial to recognize as potential pre-stroke symptoms. Some individuals might feel a sudden onset of dizziness or a spinning sensation, vertigo, making it hard to stand or walk steadily. Some individuals can experience loss of coordination, which includes trouble with fine motor skills, such as difficulty picking up objects or a sudden clumsiness. Others have sudden falls or stumbling without an apparent cause. In the case of a stroke, these symptoms occur because part of your brain responsible for coordination and movement isn't getting the blood it needs. It's like a glitch in your body's control room, affecting how you walk and balance. Number 6. Trouble speaking or understanding speech or confusion. Consider how communication is a big part of our everyday lives. Now, imagine if a stroke were on the horizon, it could seriously disrupt this vital ability. It can affect the areas of your brain responsible for language. These areas are essential for constructing words, forming coherent sentences, and understanding what others communicate. When a stroke begins to interfere with these language centers, it can lead to symptoms like slurred speech, difficulty in choosing the right words, or even trouble in pronouncing words properly. Some individuals may find themselves sounding as if they're speaking an entirely different language, or like their tongue is all twisted up. Conversely, they could have trouble understanding what others are saying. Some individuals may also suddenly feel disoriented, having trouble recognizing familiar places or people. These symptoms usually occur suddenly and are a major red flag. Unlike gradual cognitive decline seen in conditions like dementia, stroke-related speech problems or confusion come on rapidly. Another warning sign often overlooked is difficulty swallowing, known medically as dysphagia. Picture yourself enjoying a meal or a simple drink, and unexpectedly, swallowing becomes a challenge. You may feel like your throat isn't cooperating and the act of swallowing becomes a conscious effort. It's a sudden and unusual difficulty with a basic function that most of us take for granted. When a stroke affects the brain areas controlling the muscles in your throat and esophagus, swallowing can become unexpectedly hard or even impossible. Number 8. Unexplained fatigue. This type of fatigue is more than just feeling tired. It's an overwhelming sense of exhaustion that might not be alleviated by rest. This fatigue is often described as an intense and unexplained tiredness that comes out of nowhere, leaving you feeling drained and unable to carry on with even simple tasks. Unlike gradual fatigue from chronic conditions or lack of sleep, this exhaustion can appear suddenly and unexpectedly. When a stroke is looming, it can affect the brain's energy management. This disruption can manifest as sudden severe fatigue. It's your body's way of signaling that something is not functioning correctly, and your brain may be struggling. Fatigue is a non-specific symptom and can be associated with many conditions, but when combined with other warning signs like sudden headache or weakness, it can indicate a higher risk of stroke. Number 9. Nausea or vomiting. Imagine you're going about your day and without any warning or apparent reason, you're struck with a wave of nausea or an urge to vomit. This isn't just a stomach bug or a reaction to something you ate. It's an intense, out-of-the-blue feeling of sickness. This type of sudden nausea or vomiting typically appear without stomach pain or diarrhea. However, it is often accompanied by more recognizable symptoms such as headache, dizziness, or altered consciousness. Strokes, especially those involving the brainstem or cerebellum, can lead to these symptoms. The brainstem controls many of our basic life functions, and when it's compromised, the effects can be widespread, including gastrointestinal responses like nausea or vomiting. Another critical warning sign that should never be ignored is fainting, or a sudden loss of consciousness. Picture this. You're engaged in a routine task or simply walking, and out of nowhere you feel lightheaded, dizzy, and then everything goes black. Fainting, medically known as syncope, can be a significant indicator of a stroke, particularly if it occurs without a clear cause. It happens when the blood supply to your brain is momentarily insufficient, leading to a blackout. This can be due to a stroke interfering with the brain's blood flow, temporarily disrupting its normal function. While fainting can have various causes, its occurrence in conjunction with other stroke symptoms, such as weakness, or changes in physical or mental status, could indicate a stroke. As we come to the end of our discussion on the 10 early warning signs of a stroke, remember that knowledge is power. Understanding and recognizing these signs can be a game changer in preventing a stroke or minimizing its impact. Your health and the well-being of those around you could depend on this crucial awareness. If you or someone you know experiences any of these symptoms, don't hesitate to seek medical attention immediately. Time is of the essence when it comes to strokes, and early intervention can make a significant difference in recovery. If you found this information helpful, please give us a like, share this video with your friends and family, and subscribe to our channel for more health insights and tips. Your engagement helps us to spread awareness and could help someone recognize these crucial warning signs. Thank you for watching. Stay informed, stay vigilant, and here's to your health and well-being. Until next time, take care.